I'm Dr. Jessica Eastman, and this is an open Q&A. And everyone who's present to please join us by turning on your videos.
This question says, what is your perspective on celibacy? I have been not having sex and I feel like I'm putting too much worth on retention. I feel like it's the end all be all and will solve both my problems. Okay. I have no idea what the official stance on is regarding celibacy in this program. So what I am about to say is my own professional opinion. But in my opinion, we need to treat porn and sex addiction in the same way that we treat disordered eating, which is to say, like, this is an addiction that you can't be abstinent from in most cases, right? Like, very occasionally there are people out there who would be happy to not have any sexual activity in their life, whether on their own or with people, like people that become a monk and join a monastery and take a vow of celibacy. But that's not true for most human beings. And I think that is okay. And I think that is one of the things that makes this type of addiction particularly challenging, similar to food addiction or disordered eating, which is in the addiction umbrella, is that you can't be abstinent from it. Not really. And so it might be that there is a temporary period of celibacy. And then I think the work is in figuring out how to have sexual activity with yourself and then eventually down the road, maybe with others, in a way that honors your new patterns and behaviors and mindsets and the person that you want to be, right? And this is tricky. It's really subtle, right? Like there can be ways where you are masturbating in a way that is just like furthering your old patterns, or doing it in a way that is genuinely caring about yourself and furthering your capacity to be the best version of yourself. And that's what you got to work towards. But that is definitely like, you got to figure that out for yourself and probably do some work with your APs and maybe talk to the guys in the Reboot to figure out like what are some cues or frameworks or something that you can use to help you make those decisions. The Sex Addicts Anonymous, like the equivalent of Alcoholics Anonymous, talks about this as well. I forget the language they use, but like they're essentially saying the same thing, which is like figure out how to have some type of healthy sexual activity in your life, whether solo or with a partner, but in a way that actually honors your healing and your growth, and it doesn't feel like addict behavior. And like kind of going back to what we were talking about at the beginning of today, like that is a qualitative assessment that really only you are going to be able to be honestly able to assess. Like nobody else, the obvious ones, somebody's going to be able to look at your behavior from the outside and say like, yeah, that was addict behavior. But a lot of it is mindset that an outside observer, or like you're telling the story to somebody, is not going to be able to identify. So this work isn't about you getting like brutally honest with yourself and saying like, is this serving me? Is this helping me? Is this being a better version of myself? Or is this pulling me backwards into this person that I'm trying desperately to outgrow?
Like how like celibacy is pretty much just like abstaining from, well, let's say like if after having this behavior, this addiction, and then you try to go change it, and then you try to learn all these new things, and then on this different capital, instead you kind of get like more like a repulsiveness, like a repulsive reaction to stuff that you were before, it used to be before.
That's a different thing. That's not an uncommon thing in this circumstance, but is like gonna require some one-on-one support to help you work through that and to really like parse out, did I do something wrong? Did I actually make the right choices? And it just is a new feeling for me to be able to do this in a healthy way. But no, what I'm talking about here is like when you want to engage in sexual activity in a healthy way, and how making sure that it is serving you and is done in a way that like honors and respects your recovery process.